I'm very excited to be here to share with you one of our research work under the No Poor Project, social protection. In this research, I will share with you the descriptive findings from our project. So I will take you through the background, objectives, methodology, findings, conclusions, and then the policy recommendations that are very important for policymakers to consider. Social protection programs have become a very important and major policy framework using to deal with poverty and vulnerability. And cash transfer systems are being used by most developing countries in order to deal with the consequences of abject poverty and vulnerability. Ghana has made a lot of strides in terms of fighting or reducing poverty, but still, Ghana adopted the Livelihood Empowerment Against Poverty, which is a cash transfer system to help reduce poverty, that is extreme poverty. While evidence from other countries in Latin America, such as Brazil, suggests that effectiveness of cash transfers in reducing household poverty and vulnerability, very little is known about that of Ghana. And that is understandable because we adopted this in 2008. It is against this background that CDD Ghana, under the No Poor Project, sought to assess the case of the LEAP, that is Livelihood Empowerment Against Poverty Program, as a better policy alternative to address poverty and vulnerability in Ghana on 3 dimensions. That is social services, asset accumulation. We use the poverty index of the country in identifying the extreme poor communities. This was piloted in 2008 as a means-tested program in 21 districts, covering about 80,000 beneficiary households. As I speak with you, the program has been expanded and covers about 90,785 beneficiary households in 144 districts. And again, I must say, currently, there is discussions with the World Bank to expand the program to cover more communities. The breakdown of the cash payment that are given to eligible member in a household ranges from 48 Ghana cedis, which is equivalent to 12 United States dollars. A household with 2 eligible members also receive equal amount to $15, and a household with 3 eligible beneficiaries receive amount equivalent to 18 United States dollars. And a household with 4 receive an amount equivalent to 23 US dollars. What was our objective when we embarked on this particular research? Our main objective was, 1, to ascertain the influence, the impact of the LEAP cash transfers on the living conditions of beneficiary households in the following areas. 1, are the beneficiary household able to help their children access basic education? Are they able to access healthcare services? Are they able to have food security and also some form of asset accumulation? Are they able to feel that they are citizens of the... What was the sampling or the methodology used? We used multi-stage sampling procedure. And with this, we received a data on LEAP beneficiaries from the Ministry of Gender, Children and Social Protection that has the supervisory responsibility over the program. And with this data, we did a random sampling technique to select a total of 40 districts spread across the 10 regions of the country, Ghana. With this, we again used systematic sampling to select a total of 160 beneficiary communities across the 40 selected districts. So you have 4 communities per district. And each community, we again adopted random sampling procedure to select 15 beneficiary households, yielding a total of 2,400 beneficiary households across the country. In a given selected household, a purposive sampling was employed to select. The research, as I stated earlier, was looking at certain basic things. So one, access to basic education. The research identified that 83% of the household interviewed children enrolled in school before they were put on the program, while 40% of the household beneficiary children education expenses are paid by the parents. And out of these, 27 of them, the beneficiaries responded that they used the LEAP cash for education expenses of their children. 16% of them, and then 17 respectively, stated they either do not know or relatives take care of their children's educational costs. We also wanted to find out if LEAP assisted in providing educational materials, that is learning materials for the children or the lad, for their girls. And for girls, this is very important. 12% of them also use it to purchase school bags for their school-going children, 12% again for shoes, 18% for learning materials such as pens, pencils, mathematical sets, among others. And then 21% of them also used to buy school uniform. And then 25% textbooks, which are very critical for education purpose. We also wanted to find out from the beneficiaries whether their children are always in school or some of them absented themselves. And then with this, we found that 5% of the children, beneficiary children, absented themselves from school just to help their parents in farm activities. 34% also refused to go to school or absented themselves due to inadequate education materials or school supplies. And quite great number or great percentage of beneficiary children couldn't go to school due to extra demands from teachers. How about access to health? We also were interested in that. Is any member of the household registered or being covered by the National Health Insurance Scheme operating in the country? We found 7 were assisted or registered on the health insurance scheme through the LEAP program. We wanted to know why some of them were not registered. About 59% of household members, and 13% of them had been registered but had not received their insurance cards in order to access health care. How does LEAP transfer assist in providing other healthcare needs? We observed that overwhelming majority of the respondents, that is 72% of them, stated that they use the LEAP cash to buy drugs from chemical shops. Quite good number, that is 19% of them also stated that they use it to take transportation to get to healthcare units. 6% traditional herbal alternative medicine, that is what they use their cash, LEAP cash for, and then the rest. We were interested because if you are very poor or extreme poor, food is very critical for you. So we wanted to know household food security, and we wanted to find out what they use the LEAP cash to purchase. And quite good number of them, that is stated, 37% says that they use the LEAP cash to buy rice, 20% says they use it for eggs, others biscuits, and it's understandable because some of them, the children, you will need some biscuits and milk and other things like that for them. We were also interested if any of the beneficiaries couldn't get food to eat and why. 75% of them stated that LEAP cash transfers is not enough to provide enough food for the household. So if you are a parent and you have about 3 children, then you will sacrifice and then give the food to the children. So some of them were actually going without food. Some also explain about 16% stated that household members are too many, and then others also spent the LEAP cash on other important things. How about asset accumulation? Because to leap out or to get yourself out of abject poverty, you need to have some assets that you can invest. We wanted to know whether the LEAP cash transfer assisted any of them in purchasing agricultural tools, because majority of the members interviewed were farmers. We observed that more than 80% used their LEAP money to buy agri tools like cutlasses and hoes. However, only about a quarter of household LEAP beneficiaries bought agri inputs such as seeds, fertilizers, and then pesticides. Has a household invested part of the LEAP cash transfer into any other economic activity so that through that you can earn extra income to assist yourself? We found that only a third, that is 37% of households, had invested part of their LEAP transfers in other economic activities. And the main activities included petty trading, food vending, so you see a lot of them selling small things, and then others also selling food. How about civic participation and how relationship with community members and family members after being on the LEAP program? Members expressed that before the LEAP program, they considered the state to be so unconcerned about their needs. So 36% and 32% respectively felt the state was uncaring and neglectful before the LEAP program. And that is okay. If I'm poor and the state is not doing anything to better my lot, I will consider the state as irresponsible. However, 91% of them feel very good about having cash entitlements from the state. And 72% said the LEAP program influenced their trust in the state in responding to their needs. So after receiving the support from the state, they consider the state to be more responsible, attending to their needs. 67% said the LEAP program made them interested in participating in communal activities. So these people started enjoying community activities, contributing. 87% also said they feel confident to participating or appearing in community gatherings after receiving the LEAP cash. What has been the relationship between beneficiaries of LEAP and their family or community members? In some cultures, if you are on support from the state, people consider you to be not all that important and people feel some way about you. But in Ghana, those that are on the LEAP program that we interviewed, majority of them, a great majority, that is 72% of them says that they feel very good. And then 23% says they feel same. 2% says, well, they feel bad that they are not responsible for themselves, but rather taking something from the state. And then 3% stated that they have no clue. Is there any channel? We also wanted to know whether there is a feedback mechanism between the institution that has oversight responsibility and the beneficiaries. So we wanted to know if there are challenges, if the money hasn't come, is there any channel that they can go to inform them about their grievances? And we observed that quite a great number said no, nothing like that exists for them. 18% stated that yes, they know some sort of channel that they can go to, and then 3% stated no. How do we conclude on this, and what are the policy implications for the institution that has the oversight responsibility? For us, we observe that from the descriptive findings that I have shared so far, LEAP is actually making some kind of difference in the lives of the poor on various dimensions of human development in the short term. improvement in children's school attendance, as we saw from the descriptive findings. Children are incentivized to be in school, health insurance coverage, community involvement, and trust in government, which is very good for effective state building. However, there is no guarantee for sustained poverty alleviation in a much longer term, and that is very dangerous. If you want to lift people out of abject poverty, there should be some form of sustainable measures in place to get them out of abject poverty. And this is because the survey revealed that the LEAP amounts were not enough to cater for household needs for food, health, and also agri inputs. We recommended, based on the findings from the study, that the LEAP cash should be increased. Also, they should establish feedback mechanism and accountability mechanisms, and also sustainable mechanism for poverty reduction in addition to cash transfers. And I must say here that all these recommendations have been taken on board by the ministry, and they have established the feedback system. The amount of money given to beneficiaries have also been increased since the beginning of this year. So this is something that is very positive. They consider this particular research as independent assessment of the LEAP program. So this week, I was involved in a World Bank meeting with the ministry, trying to strategize and also look at how best we can scale up the program. And they intend to help us to conduct another survey after scaling up the program. Thank you very much.